Hello, hello. Good afternoon. Hey, everybody. Would love to get everybody in their seats. We're about to get the program started for this evening. Good to see all of you. Thanks for being here. Some new faces, some familiar faces. Before we get things started, I do want to say a big shout out to those joining us virtually over YouTube Live. Thanks for being with us. Because you can't be here, you're able to see the two amazing demos we have from two really great partners, Vantic and Diligent Robotics with the Moxie robot. But if you're in the area, would love to encourage you to come on in, join us in person, see these demos. For those that haven't had a chance to see those yet, after the event, after the panel, do make an effort to go see those. They're really, really cool, and very much in theme with tonight's topic, healthcare. For those that don't know me, I'm Salar Taghizadeh. I'm responsible for the space. We're here to innovate with all of you. We are making ourselves available, the space at your disposal. If you have an idea, if there's a concept that we could work on together, we'd love to add value to that and hopefully do amazing stuff together. And I'm excited to announce and really just share with you that over the past 3 speaker series, we've had projects enter the space, and you'll see hopefully those as active demos here in the space as well. But love having you here. If you're still making your way to the seats, please go ahead and do that so we can get the sizzle started and enjoy the evening together. So thanks again.
Wow, it's so good to see everybody here today. I agree with Salar, some familiar faces, some new ones, which is fabulous. Hello to the folks joining us virtually as well. Welcome to the 5G Hub Speaker Series. My name is Erin Rainey. I lead the Tech Experience program here at T-Mobile. And today we are going to talk about an industry that has some of the greatest potential to benefit from 5G and technology innovation, and that's healthcare. Healthcare is a necessity for everyone and plays an important role in our lives, personally, for our families, and for those we care about. Fortunately, we live in a time of incredible healthcare resources, along with the experts to help prevent, diagnose, and treat a variety of medical conditions. However, healthcare continues to be behind when it comes to benefiting from technology advancements. From delays of digital transformation with medical records and systems operations, the rising insurance costs and premiums, staffing shortages of medical professionals and care teams, limited access to specialists and equipment, the list goes on. I think we can all relate to some of these frustrations, especially when we see how technology has evolved other industries, such as retail, entertainment, transportation, and even banking. To our surprise, COVID-19 helped raise awareness to what's possible with technology and gave us that nudge or boost we needed. During the pandemic, we had no other option but to quickly integrate and utilize technology, such as telemedicine, video calls with our doctors, and online medical tools. And guess what? It worked. It worked really well. And what's exciting is with 5G, we now have the opportunity to accelerate this technology evolution. Healthcare is now facing 2 fundamental shifts: longer life expectancies requiring more complex medical services and care, and the shift towards consumerization. Patients are increasingly playing a more active role in managing their own healthcare. Also, in the US, the national health spending is projected to grow an average of 5.5% through 2027 totaling $6 trillion, which is nearly 20% of the US GDP. And the surge in medical services is also going to result in extreme labor shortages. Recent studies project physician shortfalls in the US to reach 139,000 by 2033. 5G and technology innovation can help manage this. T-Mobile's 5G network provides the coverage, capacity, and capabilities to help transform healthcare, providing access for care across the entire country, including rural and remote communities. And it's this network that is enabling advancements in healthcare solutions, such as telemedicine and virtual care with high-definition video, online tools, and support from specialists, near real-time monitoring analytics of health devices by patients and their doctors for quick diagnosis and treatment, remote operations of precision medical equipment, even robotics, along with enhancements to medical training and procedures leveraging the latest in AR and VR technologies. There are so many innovative solutions that can improve the quality of healthcare, along with gaining efficiencies to help manage and make healthcare affordable for all. So, let's now dive into the potential of 5G and how it is reshaping the future of healthcare as we know it. Please join me in welcoming our panelists out on stage. Hello, welcome. Welcome, welcome. Thank you for joining us this afternoon. Again, some incredible panelists here with us, and I'm going to start off with some brief intros. So first we have Dr. Arun Mathews, who is Chief Medical Officer at MultiCare Auburn and Covington Medical Centers here in Washington. Dr. Mathews is dual-boarded in internal medicine and clinical informatics and oversees the quality of medical care and staff relationships at both campuses. Previously, he served as Chief Medical Officer and Chief Medical Information Officer for inpatient services at Medical Center Hospital in Odessa, Texas. Dr. Mathews led various teams in transitioning the health system from paper medical records to comprehensive EMR, achieving HIMSS Analytics Stage 6 certification, and most WIRE designation. Thanks for joining, Arun.
Thanks for having me, Aaron.
All right, and next we have Dr. Andrea Thomaz, CEO and co-founder of Diligent Robotics. Dr. Thomaz is a renowned social robotics expert and recipient of several accolades, including being most recognized as the Cavell Fellow appearing on MIT Technologies Review's Next Generation of 35 Innovators Under 35 list and Popular Science's Brilliant 10 list. Her passion for social robotics began at the MIT Media Lab, where she focused on using AI to develop machines that address everyday human needs. Dr. Thomaz co-founded Diligent Robotics to create socially intelligent robot assistants that collaborate with humans to free up their time for more meaningful work. Thanks for joining us, Andrea. Appreciate it. And thank you for bringing Moxie the robot.
Yeah, we're excited to be here.
All right, and next we have Mark McDiarmid, SVP of Technology Innovation and Industry Partnerships here at T-Mobile. Mark has over 30 years of experience in the wireless industry, specializing on radio spectrum and access network technology, radio system design, and device technology. Mark helped define the evolution and system design of T-Mobile's HSPA Plus and LTE mobile broadband network, including new radio network transport solutions based on IP and Ethernet. And what's super exciting is Mark has recently taken on the role leading T-Mobile's Technology Innovation and Industry Partnership organization, including the Tech Experience program, with the goal to enable innovative solutions, products, and services to grow our business. Thanks for being here, Mark. All right, and finally, we have Neil Jordan, leader and chief strategist worldwide for Microsoft at the Convergence of Retail and Health Industries. Neil leads the efforts to create better digital and physical front doors for healthcare services by collaborating with retail customers and partners worldwide. Neil's background in healthcare technology enables him to drive positive disruption, delivering better consumer experiences and business benefits for retail customers, and more effective and affordable healthcare for society. He was previously the worldwide health industry lead for Microsoft, where he drove the vision for the future of healthcare and led the Microsoft UK team during the NHS National Program for IT. Thank you for joining us, Neil.
Great to be here, thanks.
Woo, we got a good lineup. All right, so we're going to start off. I'm going to ask our panelists some questions, and then I'm going to turn it over here to the audience, both in the room and online. So in the room, please be sure to step up to the microphone, and online, go ahead and submit your questions into the chat. All right, let's just start off with why we're here today and the convergence of technology and healthcare and the opportunity. Would love to hear each of your perspectives.
Sure, Aaron. Thank you so much, and it's so great to be sharing a stage with some really esteemed panelists and a room full of industry disruptors, so thank you. And it's a great question because fundamentally, for me, it's quite simple. The idea of emerging technologies coming to support what we in healthcare refer to as the quadruple aim, which is quite simply maximizing and improving the patient experience, improving outcomes through quality and safety initiatives, bending the cost curve, and then finally doing all of this in a way that increases the joy and the delivery of that care for our patients. If we can get those four things done with technology, and I am a unending optimist in this space, I think we'll have done something pretty powerful. So that's why I'm here.
Awesome. Thanks, Arun. I can see your passion for this clearly. Andrea.
Awesome. Yeah, no, I'm equally excited about the convergence of technology and healthcare. And I think, really there is an energy lately of people wanting to really make a change and really be a disruptor. And I think what I'm personally excited about is the convergence of collaborative robotics and healthcare being really at an inflection point where collaborative robotics is sort of now to a stage where it's ready to be deployed in these environments. And I think the fact that we have healthcare and hospitals that are at a point where they're really ready to consider kind of workforce augmentation and having robots be able to take on and support their staff, it's a really exciting time for the industry.
Absolutely. Thank you.
Erin, great to be here, and thanks for hosting. I think it's fairly, Arun said it very well, the need for healthcare industry to think of how it's going to start the process of automating, mainly and primarily to improve patient outcomes and improve business efficiency. And the figure you quoted in your introduction was, that's $1 trillion figure. It's a huge expense for Americans. So there's a real public interest in helping improve healthcare. At T-Mobile, we've been very focused about building a 5G capability, a network that is able to accelerate these benefits and potentially transform whole industry segments. So that's why I'm here today. Very pleased to be here and excited to this conversation.
Wonderful. Thank you, Mark. Yeah?
Yeah, convergence. It's at the heart of what all of these industries need. Healthcare tech is hard. Having been at Microsoft for almost 23 years, and I'm graduating, in fact, in 2 weeks' time and leaving Microsoft to work in the convergent space. If we don't think about the broader aspects of how technology is going to be used and bring in big technology partners, network partners, retail partners, which is where I've been spending my last 3 or 4 years at Microsoft, it's very hard to get these things to work at scale. And so anything that we can do that helps technology deploy in a way that is easier, that is in a more trusted way, and that is done at scale, which I would say telco companies are one of the few peoples in the world who can do that, has to be good. I think we all understand the importance of improving the outcomes, both societally and financially, of where healthcare is today. And I think it's partnerships and convergence that's going to make that happen.
Wonderful. Thank you. So the next question, we talked a little bit about consumerization and patients wanting to really manage their own care. And we talked earlier about this in our meeting about helping people do this at home. Maybe I can hear from a few of you in terms of what you see those opportunities where we're bringing healthcare into the home so that people can do some of these things themselves.
I love that. And I really appreciate that focus on the home, because in healthcare, in hospitals and healthcare systems, we're contemplating this notion called the acuity shift, which is how much of what we do in a regular hospital setting can we actually do safely and well in the home setting. And so fundamentally, we think that that is the right sort of mindset, because home is better, quite frankly, if you're not receiving acute medical care, the chances of you having a serious safety event because of a drug medication error or a mishap with regards to communication, all of that, by orders of magnitude, are less in the home environment. So for acute care, I see the home and the opportunities that increased access and technology enablement, I see that as being a huge area of interest and focus. But I also wanted to briefly touch on this notion of the idea of preventative medicine and getting people so that they don't actually need to ever access acute care services. And so I think there's a tremendous opportunity for technologies and enablement around informing individuals around great choices around nutrition, choices around mobility and staying active. And if we can do that in a measured, incremental way, the chances of actually improving the healthcare of the population as a whole to ultimately not need, or in a substantially reduced way, need acute medical care are substantially improved. So I'm really excited, and I would respond to your question by understanding that there's an acuity shift occurring, but also there's a tremendous opportunity for population health and preventative medicine in the home space as well.
From a MultiCare perspective, can you give us maybe a percentage of what you guess that would be in terms of the acute care and what the opportunity is on this?
You know, that's a really good question. And I would say that ultimately, the future of healthcare, I think, is going to require safe spaces where quaternary care and a place that you can go if you've had a road traffic accident or need elective surgery. There will always be a place for an acute care healthcare facility. But the goal would be to shift where a lot of that care, which is about 70 to 80%, if we can shift at least 20 to 30%, possibly even 40% of those admissions so that we can actually safely manage them in the home setting, that manages the acute care side. And then the flip side of that is, well, everyone that's currently outside of a hospital can benefit from great healthcare information, access, the Internet of Things and connective devices telling you and giving you biofeedback on what you can be doing every day to keep you healthy. Those would be the percentages that I'd be shooting for in the near term.
Okay, thank you. Any thoughts? I guess, Neil, maybe from a retail perspective?
Well, yeah, and I mean, if you look at you mentioned at the beginning, the cost line, which is the one line you don't want going up and to the right, and we know that managing that line and the area underneath it, that like 75, 80% of it is down to the exacerbations and the management, or in many ways the bad management of 5 or 6 chronic conditions. And so you have got to find a way of moving where care is delivered, not just to lower cost settings, but to settings that are more constant. Now, retailers live or die on the nature of their, what they call clienteling, of knowing their consumer well and interacting with them on a much more regular basis than the typical medical services do, the typical providers do. So they have to be part of the equation that enables that to happen, whether that's nutrition, and we've just seen this week Albertsons, Safeway here, have just opened their first big kind of healthcare push. And you see other people like Walmart, Walgreens, CVS, and other people doing that. And so it's not just, people presume it's just about, hey, let's get a better experience for the consumers, which is really important. But it's actually about having more knowledge of the consumer, understanding them not just at a medical level, but just their individual consumer preferences, and using those as a way to nudge them into better health with more regular visits, and therefore doing that not just at a lower cost, but in settings that provide, for safer delivery of healthcare and for more convenient ways of doing it. And it's healthcare, so it's slow. This thing is not going to happen overnight. COVID, in many ways, made people realize that healthcare could get delivered in non-bricks and mortar establishments, and that was a good thing. But even that has not been as swift a transformation in many ways as I think the industry needs. But it is happening. People like Forward Healthcare, who we were talking about earlier, are really priding themselves in that space as well. So you'll see retail and healthcare coming together. You'll see telco and healthcare coming together in a way that ultimately provides better experiences and more regular, I don't want to use the word check-ins, but more regular nudges.
Okay. Thank you. Let's see. Any additional comments on this?
I was just going to throw in a comment about sort of what's already beginning to happen. And I think the shift, and I think, Neil, you said it well when you were talking about the effect of COVID has changed consumers, and certainly my perception of healthcare, towards prevention, right? So we've seen over the last 5 years an acceptance of personal fitness diagnostics and devices. I'm wearing one today, right? And I actually kind of like this idea of me having more information about what's going on in my day. How much workout time do I get? Am I meeting my stand-up and steps goals? So the trend has started. I think our opportunity is to think of ways of accelerating things that humans are willing to accept. But I think we also have to be very careful about how we manage information and data, and that's maybe where telco has a common interest, in the sense that healthcare is very regulated around personal health information. We're regulated around consumer information. So there's inherently a tie-up there where security, integrity of information becomes really valuable, and that's a common opportunity. But I also think this idea of being able to automate the detection of symptoms and ongoing things with consumers and patients, that's all an opportunity for sensing and detection and gathering information, and that fuels prevention without question. So very exciting times. Yeah.
Great. Thank you, Mark. I think maybe we can dive a little bit more into the security piece of it. I guess, would you say, what's the number one reason that patients have been kind of, I guess, holding off in leveraging these new technologies? Is it security, or what's kind of that threshold or that perception when it comes to their health and their personal information?
Well, I would say that security is a significant concern, simply because there's at least in the acute inpatient space, there's a tremendous understanding that protected health information has a tremendous value on the black market, and that we read day in and day out of breaches, and healthcare systems can, because of the increasing interconnectedness of these systems, can literally be brought to a grinding halt, and that is certainly the worst case scenario. So those are the things that keep, I would say, healthcare administrators up at night in terms of patient information and security and protecting that. From a consumer standpoint, I would say I tend to be a little bit more open with my health information, because if I've established a relationship with, whether it be a consumer or retail entity that has established my trust, there are things that I believe are in place to keep those, to keep that information safe and secure. It's like when a patient comes to a hospital, you certainly anticipate that there are systems and processes in place to keep you safe. And similarly, I would anticipate that a retail health provider that is responsible for my care has similar processes and procedures in place. And I would simply state that because of that level of trust, I then am open to this type of information being shared, so that a healthcare agent can actually nudge me in the right direction and provide those insights that I would not typically have without that technology enablement. So I tend to be more trusting of my personal data, but as my role as an administrator, I tend to be very conservative and very skeptical, and really hold our partnerships and our vendors to a high standard, because the notion of a data breach terrifies me for the safe functioning of our hospital.
Sure. So how does that play into when you start integrating data from devices that we're all wearing?
Well, just on the inpatient side, I would say we rely on security protocols, standards, regulatory enforcement, and that's why I've often felt that Wi-Fi as a standard comes with it a certain amount of security, but truthfully, if you've had conversations with our Chief Information Security Officer, you'd find that it's the interconnected Internet of Things where I would say that there's a lot of interest and or concern around where potential threat areas or surface areas for attacks can potentially occur. And so those are the spaces that I require my colleagues in the InfoSec space to really understand, and that would be essentially where I hand things off in terms of expertise to people that are much more savvy in this space.
Sure. Well, thank you for that. I guess, Neil, anything to add on the...
I just to add that I think trust is a bigger word than security in this space. And you've got to do security right, and the emergence of more and more chief information security officers at hospitals and allied healthcare companies. It's always a kind of test for me when you go and visit a customer for the first time and you say, so who's your chief information security officer? You're specific to healthcare and they don't have one. And you're like, there's some thinking that needs to go in there. Now, the technology, the network technology, the protocols have got a lot better over the years. The ability to take information relatively seamlessly from a cloud to an edge scenario and do that, I think has got a lot better. But I think bigger than that is, from a consumer perspective at least, is do I trust the brand and the business model of the people who I am giving my data to? Do I know that the way that data is going to get used is clear, transparent, ethical? Is it easy for me to understand that? And do I know that they are going to enforce all of those ethics and standards down to all of the people they're going to use? And we've seen too many times from big tech and from other organizations as well, not just security breaches, which I think we don't want to happen, obviously, but people kind of understand, and they are happening less and less. But worse than that, we're seeing data being used in ways that it was not originally procured, or the provenance of that data was not originally allowing for. And the more and more that happens, the less and less people are going to trust that data, particularly as we get into a world of value-based care, and where we get to a point where I think inevitably an individual's consumer habits are going to affect how their premiums work, what healthcare they're going to get access to, and you've seen that happening in some countries outside of the US already. It's going to become all the more important that people know that the data, the provenance of that data and how that data is being used is transparent, trustworthy, and easy for them to understand. And so I think you'll start getting the emergence of possibly sort of third-party organizations in between bits of the technology companies that will help converge that data.
Great, thanks for sharing. It's great to hear the word trust, and not that there's a concern necessarily over the technology, which I think gives us a huge opportunity to build upon that trust with technology, especially if we have those partnerships and those relationships. Okay, so I'm going to ask another question, and I'm going to turn it over to the audience, so you guys get your questions ready. So as I mentioned in the intro, the healthcare industry, we're losing workers, and the trajectory does not look good with staffing shortages. How can 5G and technology innovation help solve this? I'm going to start with Andrea because you've got the perfect solution.
Yes. No, I think that it is true that every healthcare or every hospital leader would tell you that workforce shortage and the ability to staff appropriately is a top concern. And I think what was a surprise to me coming into healthcare from robotics is that when you look at what some of the most highly skilled clinicians are doing on a day-to-day basis, it's not always the most highly valued work. And so that's where we saw a real opportunity to, how can we make sure that there are the the tools in place and technology in place such that the people who need to be focused on patients are able to spend as much of their time as possible focused on patients. So I think that is a real opportunity, and helping hospitals find those efficiencies and find those ways to operate more effectively with the staff that they do have is a way that we can, work on the efficiency of healthcare in general.
And that's why you helped create Moxie.
That is right. Yeah, so we have Moxie. It's a transport robot. So it's a robot that works alongside frontline staff in order to carry things that would have normally been hand carried by people, is a really simple way to put it. So lab samples, pharmacy supplies, lightweight equipment. They're all things that before a hospital that we're working with implemented Moxie, that would have been run around by a lab tech, a pharmacy tech, or a nurse.
Wonderful. And again, if you haven't had a chance, please check out Moxie here after our session today.
Can I just
oh yes,
brag on
go ahead.
Moxie
Yes,
for a moment?
please, because you guys have had Moxie
right.
at your
MultiCare is a
hospital,
partner.
right?
Correct, correct. So, I just wanted to kind of expand on the notion of wasted time and wasted steps. So, in this country, to become a registered nurse, there is a tremendous training and education pathway. And I very much consider our RN workforce to be, one of the largest knowledge worker workforces in healthcare in this country. And so when you did your time motion studies, I loved the fact that when we were talking earlier, you mentioned that it can often come down to just 10 steps around sort of the active space of where clinical care is being done. And 10 steps doesn't sound like a lot, but in the midst of an acute care episode, 10 steps repeated over and over again for an individual that is effectively a knowledge worker, but become reduced to essentially running supplies back and forth between rooms, that is not a great use of time and space. And so when I was looking at the Moxie data from Deaconess Hospital, which is one of our MultiCare hospitals, you can see how there's orders of magnitudes of benefit. And so I think I read something like 1,000 miles traversed by our robots delivering supplies between the two main areas being our core lab and our ED. And that is time and precious minutes turned into hours that translates into moments by the bedside, moments engaged in active clinical care with our patients. And like I said, getting back to that quadruple aim, increasing the thing that those nurses came into healthcare to do, take care of people.
That's right.
So, I mean, that to me feels like the real win.
That's cool. Yeah. And I love that that one example of going from taking lab samples from the ED to the lab. It has it saves the steps of the person that would have done that. But the other thing that you see is this broader operational efficiency, where if a person was going to do that, they're going to batch together a bunch of labs and wait, and so that person is the most efficient with their run to the lab. So then you have a lot of people whose lab samples from the ED maybe could have gotten done sooner if they had just gotten there faster. So we do see that kind of throughput of things just getting to the lab faster. So that's you not sitting in the ER with your son or daughter waiting for your lab results to come back.
Sad.
Andrea, maybe you can talk a little bit about the importance of wireless connectivity for Moxie and having reliable wireless connectivity.
No, exactly. So the robots do depend on the wireless environment and the connectivity of the hospital. And it's one of the first things we do with our hospital partners is do a Wi-Fi assessment, a network assessment, and talk to them about how do we modify access points, how do we make sure that this connectivity is as good as it can be. And so the promise of how much more we could do with 5G is phenomenal, because you're just talking about low latency, high bandwidth. We could be doing, we could have a lot more resources that were available to the robots and kind of taking that AI and machine learning technology to the next level. At this point, the robots tend to have everything that they need to operate on the robot itself, because you can't depend on any particular kind of latency to be available. So we have to kind of develop to that. We were talking about this earlier. You have to kind of develop to the level of network connectivity that you could expect to be everywhere. And so I think that's the real promise of 5G, is that as soon as you could start to count on that connectivity being everywhere, you can really level up the technology that you can deliver.
Absolutely.
Yeah.
Mark, do you maybe want to talk a little bit about 5G and how we're adding new capabilities to support exactly this?
Yeah, I think it's a fantastic use case you're executing on, Andrea, and I think part of our vision at T-Mobile is to create, to enable customers and partners to create deterministic outcomes. Now, if you think of the healthcare environment, specifically hospitals, the one goal is patient outcome and success. So anything we can do as a partner to make that connection to your robot more reliable and trustworthy and deterministic, you'll be more successful, and we'll be more successful, and patients will have better outcomes. So that's the goal. I do think in our world we're shifting into this new expectation of determinism in bandwidth. So you mentioned latency. Our ability to deliver a connection that has a specific latency envelope is now really valuable, and that's what we're working on at T-Mobile to change how we connect devices. So that's super exciting.
It's going to be great. Yeah.
Great, thanks, Mark. All right, do we have any questions here in the room? All right.
Hey everyone, thanks for being here. My name is Mathews. I'm a student at the UW. And a couple of years ago, I did a project on precision or P4 medicine and how 5G could potentially impact that. In this project I worked on, I was looking at how genetic data, healthcare data, and lifestyle data could basically provide a healthcare solution that is more predictive and preventative, as you've touched on, and could also be utilized in the home. And some of the biggest barriers to that was regulation and also the diversity of data that's available right now, especially in terms of race, ethnicity, et cetera. I'm curious from your perspectives, what other barriers do you see in precision healthcare, and how far out do you think precision healthcare is, at least in the United States?
Excellent question.
That's a great question. Do you mind if I
Go for it, yes.
Well, I absolutely love the notion of precision medicine because it marries the idea that we have genetic heterogeneity that makes us individual, and our very best research tools are the randomized control trials, which effectively function to show if a particular intervention is better than chance at resulting in a particular outcome. But precision medicine, I think, flips that on its head, because it takes the power of mathematics, and what I often tell medical students and residents when I round with them is, your job as the physician is to take the power of mathematics, the randomized control trial, but be that filter to recognize that you have the N of one trial, a human being with unique circumstances in front of you, and you have to be that filter. Precision medicine adds a tool to that toolkit, because when I did my own genetic analysis, I noticed that I had a cytochrome P450 aberration that basically makes my ability to metabolize certain medications different than the standard recommendation from a randomized control trial. So those tiny little insights are, I think, what get us to the next generation of medicine, actually recognizing that maybe instead of 500 milligrams of Tylenol to treat that headache, your body type, your genes, your habitus, your pharmacogenomics only needs about 373 milligrams. So that's really powerful. But the problem with these very large data sets, to me, and the problem with applying that across a population, is what I would consider to be an access challenge. about 40 to 50% of healthcare takes place in major metropolitan areas. There's a large percentage of folks that have limited access because they live in rural areas. And so when we talk about the convergence of healthcare technologies, to me, robust cellular coverage has to be part of that solution so that you can take the insights garnered and those large data sets and you can apply them to that advanced practice practitioner. So I had a chance to work in West Texas and southeastern New Mexico, and there were huge geographic swaths of communities that were actually literally managed by a single healthcare individual, whether it be an ARNP or a physician's assistant, doing incredible work taking care of those communities. But wouldn't it be amazing if they paired with a generative healthcare AI agent to do advanced clinical decision support, pulling in on those large data sets for precision medicine, could provide the same level of healthcare that a patient in downtown Seattle would receive through one of the healthcare systems here. That would feel truly like we're redressing the balance. And that, to me, is what we should be striving for the health of the nation. So great question, and I love that you raised kind of where we need to be charting our roadmap for precision medicine. To me, it's about equitability and making sure all of those benefits get to vulnerable populations.
Thank you.
Yeah,
Go ahead.
the only thing I'd add, I think, is ensuring in the precision piece of it that we're ensuring that the diversity of the people, in every facet of people who are getting involved, both in trials, but also, particularly if you look at pharmacogenetics in the pediatric space, which is terribly underserved at the moment. If you look at things like ADHD medication, which can have incredibly different effects on individuals based on pretty simple biomarkers. You've got to make sure that when you're doing that as far as is possible, that the sets and the trials and even the models, if you're not managing to take it to full clinical trials, the kind of dry lab trials, they're being done with a mind of diversity, which means that people who are programming the systems and the models are also diverse and are thinking about all these things. And it's that kind of application of, diversity isn't just about doing the right thing. In this case, it's really about, avoiding major errors by making sure you're thinking about all of the different populations that are being served. And that one, we've still got, I think, a lot of work to do.
Excellent. Thank you.
Yeah, thank you
very
guys.
Hi, everyone.
You're good.
Right.
There you
yeah.
go.
Hi. Yeah. Firstly, great talk. Learned a lot of new ideas. We touched upon trust and safety in 5G's applications in the healthcare industry, and we also touched upon nudging users to take certain decisions based on their inclinations and mapping their minds. How does that relate to the trust and safety aspect? How do we make sure that the decisions that we compel people to make about their health are also aligned with the trust and safety point that was raised earlier in the discussion? Thank you. I'm Akib. I'm studying at the UW as well.
Awesome.
Antish is my friend. Yeah.
Yeah, I'll definitely start. I mean, I think the experience that we've seen is that consumer attitudes to the use of data and actually their knowledge of how data is being used is actually ahead of where a lot of the policies are and the regulations are. And so, for example, when we've been looking at the convergence of retail and healthcare data and saying, okay, if you walk into a retailer, into a grocer, and you bring your data that's come from the pharmacy around, let's say, I'm a diabetic, and your data that's coming in, a type 2 diabetic, and your data that's coming in from the retail side of it, and you want to merge that data. Now, legally, can I do that? Actually, in various ways, you can do that. How do you do it in such a way that the consumer is happy about the decision process that goes into, I want help. I want help with understanding what my best decisions are going to be around nutrition when I'm in the store. But I want a simple, for example, a simple slider that might say, hey, at 5 out of, on a scale of 5, I want all of my data. I want all the data that you hold about me or that you can scavenge about me, about my healthcare situation, including genomic data. I do want that merged with my shopping data. And I want you to be able to give me very active nudges, at the point of which I'm, literally pulling something off the shelf that says, you don't want to eat that. You want the low sodium version of that, the low cholesterol version, the non-glycemic version of that, for example. Through to, I don't want any of that data ever brought together. And it's my right to never have that brought together, which it is. And having the simplicity of saying, what are the levels on that scale that will enable me to make that decision for myself. And in fact, a lot of the work that we've been doing with people like Albertsons and others in this space have been about bringing that data together. It's relatively easy to do it from a compliance perspective, but are you bringing it together? And it's a great point that you raise from a sort of a trust and ethics perspective, and then being super transparent about how it's being used and where the data is and isn't going. And it is going to develop. People's attitudes are going to develop. The incentives for them are going to develop. And we're already seeing models more out of Central and Eastern Europe and out of Asia where that data is being resold with the patient's explicit consent because it gains them access to other capabilities, for example. So it's a really, really interesting model of how that's going to get done. And it's technically relatively possible. It's now really a question of doing it in a way that is flexible enough as attitudes change, as they will do over the next 5, 10, 20 years.
Thanks for the insightful answer.
Excellent.
Hi, good afternoon. My name is Ohad Barnoy from Amdocs. Great session. Andrea, first anecdote on Moxie. The minute I saw Moxie, it threw me back 25 years when my wife was in labor in Hadassah Hospital in Jerusalem. And she has a rare blood type, and they needed to do a blood test, and they had nobody to take it to the lab. And they asked me to take it to the lab. This was 25 years ago, mind you, so things were a little bit more lax, but I actually took the blood to the lab, had to stay there until the results were back.
Right.
Missed about 25 minutes of the labor, which I'm not sure it's bad or good, but I should have been there for my wife. But in any case, when I saw Moxie, I said, that would have been awesome 25 years ago.
There you go.
My question to you guys today is, Mark, you mentioned about using data in order to identify potential symptoms and some preventive care. And Arun, you mentioned, about the safety, security, and you just mentioned again about, so going back to my wife, fast forward 25, same wife, still married. We recently relocated here to Seattle, and she's been having like eye problems for a while. Long story short, she went to see an eye doctor here. After 2 years of seeing eye doctors in Israel without finding the problem, eye doctors sent her to an MRI, and they found, by the way, she's fine. They found a tumor the size of a golf ball, a cyst actually, not a tumor. And the surgery was a week later, and she's fine now. My question to you guys, is there any way we could have done better in the sense of using data that would have been maybe available there, either from sensors or other things that could have prevented this ordeal from her side of 2 years of back and forth?
So I'll jump in on that one. And, I think it's a really interesting question because fundamentally what we're talking about is this notion of screening versus symptom-driven sort of assessment of disease. And, there's a national task force called the AHRQ, which it's a healthcare quality task force. They publish a series of guidelines as to when it's appropriate for the risk versus benefit of a screening test. So colonoscopy, which traditionally had been at the age of 50, got pushed back to 45. And that was because a number of meta-analyses had come back and shown us that there's a benefit for going through the procedure of a colonoscopy 5 years earlier that might result in more lives saved. And so I think the question that, as stated, was really about finding this balance between screening and symptom-driven care. I'm not aware of anything other than sort of your standard good preventative check in your PCP and a follow-up sort of annual appointment for individuals with certain risk factors with an optometrist or ophthalmologist. I'm not aware of anything that would have significantly adjusted your risk in terms of capturing that earlier. However, what I will say is that as we get better at understanding biosensor technology and as we start adjudicating sensors that are attached to the human body through various different companies, we will uncover different insights about things like rare to uncover heart conditions, skin conditions, that will, I think, start to change those screening parameters nationally. And the reason for that is that you don't want to actually overscreen your population because that can lead to an increased unnecessary testing rate that can also have its own problems as well. So I think the long and the short of it is, as sensors become more used in the human population, we'll uncover more insights. And the key here is I wouldn't want to create a standard around screening that would unnecessarily result in the population having to go through unnecessary tests. So to your point, I think you did great. You were a fantastic healthcare consumer. You followed the symptoms. You were fastidious with it. And I try to share this on as many public forums as possible. Have those conversations with your primary care doctors or your primary care physicians or APPs. Because those skin checks, my wife, we're Indian, and so we had this joke around, oh, Indians don't get melanomas. We got back from a particular case, and our doctor with Forward put us through a skin scan test, and we were like laughing, and he found a particular mole on my wife's leg, and he said, let's keep an eye on that. And a month later, she noticed a little bit of itchiness, and then we actually went and got the biopsy done, and it turns out there was atypia features. And so I do think there's a real role for technology to really nudge us in the right direction for making us aware of when the right time is for those types of tests. So your colonoscopies, your skin biopsy tests or your skin scans, your blood pressure checks, et cetera, et cetera. So a little bit of a long-winded answer, but the long and the short of it is that as we get more comfortable with sensor data, we'll uncover newer insights.
And I think also, as we talked earlier, too, about if you can do some of that at home. I don't think anybody wants to do a colonoscopy at home. But when you think about, high-definition video and being able to look at, your skin and share that with your doctor, those are the types of things that I think we have a huge opportunity with.
Yeah, and post-acute recovery.
Yeah.
Post-acute recovery, and particularly in complex surgeries, and if you have centers of excellence where you're pushing people out from the hospital out for months at a time for their recovery, if you can keep a much more real-time connection and flow much better data into the system, and then the real key is then aggregating that so that you just get smarter and smarter and smarter about bringing that data together and then predicting exacerbations or issues or complications down the line. That is almost as important as the initial screening and the initial diagnosis.
Well said.
Absolutely. All right, looks like we also have a question online. Salar.
Yes, we do. The question is from Benjamin Lee Stewart. and it reads, what do you see as the most apparent roadblock for 5G being widely utilized in the healthcare industry?
Yeah, I'll jump in there and I'll share that in dialogues we were having at T-Mobile with one of the major healthcare providers, we learned that they had connected better outcomes for their patients that were in facilities, hospital settings, with the presence of great high-speed, reliable broadband connections to the devices they brought with them. So my father, I'll keep this brief, but he was in hospital earlier this year, and normally the routine would be calling family going, I need some more pajamas. But no, this time it was, no, I need my charger really quickly. So he was using his device to stay connected with us, and in the case of this healthcare system, they determined that healthcare patient outcomes were improved more frequently if they had great coverage. So having great 5G coverage in hospital facilities, outpatient facilities, absolutely can make a difference. And I would say that's the first thing to do. That infrastructure can be reused to do all of what we've been talking about in the hospital setting. So we don't need two sets of infrastructure anymore. We know how to do it with one set. That's part of the opportunity. But we need to have a different dialogue with the facilities owners in these businesses, the healthcare setting. Hopefully that helps. Yeah.
Thanks, Lar. All right, another question here in the room, please.
Thank you guys for the talk today. Really learned some good insights about the healthcare industry. I have a question about the security when it comes to connecting the healthcare industry using 5G networks. So one aspect is protecting the patient data, but then the other aspect of security is the security of the infrastructure itself. That is the 5G infrastructure that is providing services in these hospitals and healthcare facilities. What steps is T-Mobile as a service provider taking, whether it's deploying private 5G networks or you're providing connectivity through your macro network? What are the different steps that T-Mobile is taking to ensure security as far as infrastructure is concerned? Because there's a lot of IoT devices that are coming on board, and IoT devices really don't have that tight security hygiene.
Yeah.
So what steps are you
I'll
taking?
throw a couple of ideas out there and hand it to my colleagues in the panel here. I would say first and foremost, working with partners around the physical integrity of infrastructure is absolutely crucial. So hospital systems are very familiar with the problem statement of securing pharmaceuticals, right? So that discipline and logic, we can help with partners when it comes to securing physical infrastructure. With 5G SA mode, which is the very most advanced form of 5G that we have fully deployed at T-Mobile, we're implementing security protocols that would ensure that there was no intrusion in the flow of the call or session that's maybe communicating patient information. And of course, the bedrock of all of this is massive levels of encryption to the degree that some countries in the world are not allowed to use certain algorithms. Only certain countries within the techno-democratic societies that we know are allowed access to those, and that includes the United States. But bringing those levels of diligence and focus to infrastructure deployed in facilities is absolutely required as a minimum, and that's just the starting point.
My question was more along the lines of how with evolution such as Open RAN and some of the vulnerabilities known for protocols such as SCTP, which form the backbone of the RAN networks, kind of steps that T-Mobile is taking.
Yeah, with some of the more open, I mean, the promise of open sourcing computer systems is that they will become more advanced, more efficient, more quickly. And the challenge is, will they become more secure more quickly? And all I can tell you that is at T-Mobile, what we're doing is certifying equipment by putting it through the ringer. So if it's not adequate for us to deploy, we would never recommend a partner deploy either. But I do think there's a tremendous risk. I mean, in certain segments of industry in the United States, there's a little bit of naivety around taking supply of equipment from certain nation states, that maybe it's okay, but really it's not okay. So I think recommended and certified gear is absolutely required. And as T-Mobile, we're here to partner and advise and support our customers in making smart decisions. Yeah.
Thank you.
Thank you.
Thank you. Next question.
Hi, this is Akal from T-Mobile Device Technology team. I have a question. So with the expertise we have in the medical field in the United States of America, and a lot of patients coming from outside outside America for the maybe medical diagnostics or surgeries and all. So with the evolution of the AI and 5G with the low latency and high bandwidth and all, is there any way we can provide surgeries remotely to the other countries and making sure the patients instead of during the patient transition, or maybe their situation will get deteriorated, or maybe they may lose their life. So instead that maybe like long hours of the transition and all, is there any way with the evolution of this 5G can be remote surgeries can be done with maybe the robot on the other hand, or maybe providing more technological services to the the maybe medical services on other countries and maybe handling remotely, if that is possible. So in that way we can save the the lives of the long transitions.
I'll throw a concept out there. It's a big question there. I think we were having a great dialogue over lunch about what does transformation really mean, and I think I certainly got a tremendous insight from the panel about how sometimes transformation is not about doing the big things, but doing the small, meaningful things on the ground that are the seeds for bigger change in the step. And I think, Andrea, what you're doing by automating some of the more routine tasks actually allows for upscaling staff. So I think great example of small things make big differences.
Exactly.
Yeah.
I would simply add that certainly there have been use cases and site demonstrations for remote surgery, and some pretty compelling examples. The thing that I would struggle with would be the sort of the democratization of that technology. It's incredibly expensive technology, and there's typically an operator operating a robot, and then there needs to be a whole separate robot in that other remote site where that that robust sort of communication feed is going to, and the surgery is being done. That I would say would potentially be cost prohibitive for many communities. What I do think would be a compelling interim step would be in the use of remote education technologies to really get more to a train-the-trainer methodology, where a single device could be used to train an auditorium full of surgical techs and individuals in remote circumstances, so that they can go and perform surgeries. Because I think the value proposition is much higher with the education side of things than with the brute force technology implementation in a distributed manner. So both of them require robust 5G, low latency access, but the second scenario I think would require far fewer very expensive machines. So that's just my take on it.
Thank you.
I'd just add, and with diagnosis as well. So the belief, or the belief is virtual care happens between a doctor and a patient. But actually, if you think about a specialist and a generalist more broadly distributed, and this isn't just about how do we scale that knowledge into rural Africa, this is about how we do it into rural America as well. So how do you use the network optimally to enable real-time kind of three-way virtual care delivery, both at a diagnostic or a treatment level. It isn't necessarily as acutely difficult to scale as some of the robotic surgeries would be.
Thank you.
Thank you.
Hi, my name is Trisha. I work here at T-Mobile as well, and I'm so excited to see all these.
Mic drop.
So along the lines of international collaboration, I would love to see Moxie evolve into an Android that can actually pick up specimen from a remote area, like a refugee area where earthquake hit people and, bring back medicine or something. Is there any thoughts on that?
I think that's a huge opportunity. Yeah, I mean, I think our vision is that robots would be able to take on all kinds of tasks that are collaborating with people, collaborating with care teams. So supporting a care team and augmenting that care team with tasks that are, in this case, maybe dangerous or just aren't enough people around to do. So I think, yes, we can use, the robots today are augmenting, staff in acute care hospitals. We see a lot of need in rural hospitals in particular. So, there's, some of the biggest workforce challenges, and you see the most highly skilled staff actually running around to the lab or to the supply room are in some of the rural hospitals that we support. And I think eventually we could certainly look at and taking that outside of the acute care setting to other sorts of places. So I think it's a real opportunity for robotics to think about not that it has to be an autonomous robot doing this thing all by itself, but that it can really plug in and be part of a team of people and helping that team of people be better.
Thank you.
Great question. All right, any other questions here in the room? Oh, here we go. Oh, perfect.
My name is Neil. I'm with Mobile Integration Work Group. Looking at 5G in healthcare from a record transport standpoint, delaying a diagnosis to a specialist worldwide in real time could literally be the difference between life and death. With that being said, what is the future you're seeing when it comes to transporting this critical information to mobile devices? Real-time records and on-demand without being tethered to a computer. Thank you.
I'll throw one thing out there, and then I want to have the panelists comment. But I think Neil, you said it so well. Consumers primarily are concerned about trust, and trust in this world typically translates to the brand, right? So, I think when we look at mobile devices, we have a kind of story of two big companies, right? One which has set its stake in the ground around privacy and protection, and your company, Neil, has done something very similar, right? And those brands are going to be equipped to help facilitate exactly what you described, the conveyance of customer information without betraying it or reselling it, right? So trust in the brand is crucial. I know at T-Mobile we're very focused around making sure people see the brand of T-Mobile as authentic and trustworthy, and that's the only way forward when it comes to data and information. But that's not true of all mobile operating systems, right? That's the honest truth, right?
Any other thoughts?
I would simply add that, in the late 80s, 90s, as we were kind of warming up to the notion of an electronic healthcare record and structured, organized data that represented my healthcare information, there certainly was a trend towards this notion of the PHR, the personal healthcare record. I think we as a society have migrated away from that largely because of the sheer size of these healthcare records now. We've transitioned into, large data sets, thanks to things like personalized medicine, precision medicine, genomic data. And if you think, short nucleotide peptides sequences of a person's genome are a good-sized data set. Wait till we start handing off whole genome data sets to get to better conversations around whether we should, buy NyQuil or not. But fundamentally, I think they're so big that the idea of the personal healthcare record, something that you carry in your pocket, is a little bit unwieldy. I think the natural evolution to that is where you are a healthcare agent and you have autonomy and you can grant access rights to healthcare entities to help make smart decisions on your behalf. On this pulpit, I would simply state that I think it's really important for people to be possessive and want to have control of the access modalities to their healthcare data. I think there's a tendency in the world of corporate EHRs to say that, to take a more paternalistic stance and say, hey, we'll take care of your data for you, you can trust us. And I do think trust is a tremendous, that the brand activation and the security protocols, all of that is tremendously important. But in medicine, we say informed consent is king. And so I would want control of who has access to my data, and I would want to opt in and opt out accordingly when I move town and no longer, and that healthcare entity or agencies no longer need access. I would want control of that, and I think that's probably a best practice. So that's the only thing I'd add.
Oh, go ahead, Neil.
And I'd just say on that piece that PHRs, particularly as Microsoft built one and then shut it down, it failed. There was a thing called Health Fault. We learned through that experience, and Google Health did a similar thing and pulled it up, shut it down, is how little consumers can actually use and actually are interested in their full health record. Or even a small, minute version of that. I think that the real point is about they want their healthcare record to be movable and they want to have control over it. And there are standards, FHIR being the obvious one, that are emerging that will make it harder and harder. You were extremely political in what you said. That'll make it harder and harder for the EHR providers themselves to maintain the walls that they have over the years around that data. And that is all a very, very good thing, as long as that data is then used in a way that is ethical, trustworthy, and that people know how it's being used. And the technology itself is getting better and better. So, you can have a consumer-grade device like an iPhone or a Samsung phone where you can take pictures locally of wounds or of dermatological scans, and the cameras are getting very, very interesting as far as that's concerned. And that data is never stored on the phone at any point. And so it is all kept inside a HIPAA envelope of doing that. So I have a lot of positive thoughts about where all of that will go. And also the ease. Someone in the question earlier about how a 5G network's going to help healthcare workers. They should be able to do the work. Well, number one, frankly, the filling out of an electronic healthcare record should be a lot easier and should be a lot more ambient. And there's an acquisition that Microsoft made in that space of a company called Nuance, and there's lots of exciting stuff being announced this week at HIMSS around all that piece. But they should be able to work safely, securely within HIPAA and even stronger trust regimes to do that. And it's the network that's going to enable them to do that. I saw a lady on a plane the other day filling in an Epic patient record at 30,000 feet on her iPad. And whilst it was technologically amazing that she could actually do that, it was an enormous HIPAA issue, not because of the technology, but because I could lean over her shoulder and see exactly what she was writing into that. So in many ways, the tech is already there, and there should be more availability of those records with the right consent models moving around the system.
Thank you. Go ahead, please.
Oh, hello. I'm Sumaid. I'm from UW. And then I just had a follow-up question to the discussion that was happening over here about electronic health records and how they're being transferred and everything. I just wanted to know how, if I have my records in a certain hospital, and then if I want to go to a different hospital, how would I be able to transfer them from that hospital to another hospital? Yeah. What all challenges there would be, and then what all infrastructure would be required for those standards to be enforced?
It's a great question, and quite frankly, the general term that you're referring to is this notion called interoperability. So the idea that you as the healthcare consumer, utilizer, patient would have control of that information and could say, health system 1, I'm moving to this other place, or I was taken by ambulance to this other place, I give permission, whether electively or emergently. You can kind of set up mechanisms to say automatically you would want that. And an interoperability standard, very nicely sort of preambled, FHIR or Smart on FHIR, would allow two disparate or agnostic systems to safely convey that information. Because ultimately, you don't want like a 2 gigabyte PDF sent over to your healthcare team. That is effectively, all the information's there, but it's effectively useless to that healthcare team. You want it migrated in such a way that your healthcare team, your doc, is used to seeing that information in the EMR of his or her sort of comfort level so that they can make smart healthcare decisions. That's what the dream of interoperability has been. I feel that it's sad that in the latest iteration of the HITECH Act, and in fact the CARES Act, that interoperability was not defined and enforced as a regulatory standard. And I think I have some thoughts about that, about why that is. But so unfortunately, in this day and age, if you are dealing with two disparate EMR systems, it's a fairly manual process. You have to go to the medical records department of the other hospital, sign a release. They have to get in touch with the medical records department of hospital A, and then an interchange happens, and it's usually burnt onto a disk or through a HIPAA-secure email sent via PDF. Again, we've explained why neither of those solutions are very good, with the exception of maybe being imaging. So you wouldn't, if you had a couple of CTs done, you wouldn't want to have to repeat unnecessary radiation imaging. So they could look and make some decisions there. But that, to me, gets away from the true promise of what facile interoperability, what the promise was meant to be. And I think, quite frankly, the regulators would be the ones to help really define and enforce that.
Thank you.
Thank you.
And
all right.
You've definitely seen in other countries.
Yes.
That the government,
yes.
and in many cases, the government is the payer, so it's been able to have control over it.
Well, right.
And even in relatively fragmented but government-payer environments, there have been more strides towards that environment. That you are. It's strange to call it an ideal environment. It should be a very obvious environment, right? That it's more possible, my personal view, and I can probably explain that a little bit more particularly as I'm leaving the corporate world, is that we haven't really made nearly enough steps in the US, and there's been huge pushbacks for not well-made reasons, to be honest with you, against interoperability, and we just have to move faster, particularly in the US.
Agree.
Thank you. All right, our last question, please.
Thank you. My name is Jay. I oversee product at Ventari VR. We're building a virtual hospital. So my question's around mixed reality and how the pipeline that T-Mobile has laid for data and interconnectivity for remote learning and remote training. So my question is pretty loaded, but building on the great questions asked in the forum today, we touched upon medical error, or medical oversight until patient became symptomatic for a misscan or an assist in this case, or burden on healthcare workers for which is resulting in understaffing, and the theme of the day being connectivity on the freeway of cellular data. What are your thoughts on virtual digital twins of human data sets that enable surgical planning, the remote experience, or remote expertise? For example, we were just at a conference, American College of Cardiology, and some of the physicians that typically come to such a conference from Southeast Asia, Africa, emerging world, they couldn't get into the country because the visa wait time for such an appointment is about 18 months, even physicians from India. So that seems the ACC reached out to us and essentially said, can you bring two avatars that can then perform the surgery together in a virtual space to host this workshop, because then they can go back and teach the masses and actually perform. So obviously this is a huge opportunity in generally about how data or network can solve some of these problems. So what are your thoughts on how to accelerate on such innovation but interconnectivity between countries? So for example, India is still operating on 4G in most areas. So is there anything that T-Mobile is doing in that sense to kind of grow presence there?
I think we're very much, I mean, the part of what we're doing today is dialing in and listening very carefully to people who are really much closer to the opportunities than T-Mobile is. Our job here is to figure out how do we make data analysis and compute power available more quickly and more deterministically, right? So here in this facility today, Aaron and the team have brought together access network, transport networks, and massive compute, which is over there in that big tower, so we can do things very much in real time. So those are things we're working hard on. The things we can't change are the time it takes to transport information between continents. There's a genuine speed of light problem there. But anything we can do to reduce the latency is going to improve the mixed reality experience, and that makes it a more human experience for the practitioner, and maybe it's a training situation like Arun mentioned. Those things become richer and more immersive. We're going to end up amplifying and improving the intelligence and capability of caregivers, and that's pretty damn exciting. Will we be able to do it across continents? Probably in some use cases that are not real time. Yeah, I think so.
Thank you.
Yeah.
Great question. Thank you. Anything?
I really like the question because I do think there is a dichotomy between real time and non-real time. If you get into the asynchronous space, I think the use cases just proliferate. You know, I worked with a small group of folks who were looking at using AR helmets so that a layperson could essentially put on an AR helmet and then be talked through how to do high-quality chest compressions and how to run a code because of the overlays that were occurring in real time. And so from a simulation standpoint, I think we're just scratching the surface in terms of all of the different use cases for training healthcare workforces and being less role dependent and more just technology access dependent, so that anyone off the street, like the goal would be to really have a large healthcare workforce, technology enabled, to render care for the health of the nation. Like that is ultimately where I think a lot of the promise lies. So.
Great. Well, thank you. All right, I think we could go on for hours. I think I'm going to have to invite you guys back for maybe Healthcare Take 2 or Part 2. Yeah? Well, let's go ahead and give our panelists a round of applause. Also, our audience for some excellent question. Again, just some great discussion, great insights. Thank you very much. And good news, we have our next session on May 16th, and the topic is the metaverse. So you'll definitely want to check that out. You can register at techexperience.com. Thank you again. Again, if you are here, please be sure to check out the Moxie robot. Take a selfie, post it on social, tag Tech Experience, and please enjoy the evening with some more networking and happy hour. Thank you very much, you guys. Bye-bye.
Awesome. Thanks, everyone.